Uterine prolapse. How to manage it. First, wash the prolapsed part with antiseptic solution like KMNO4 iron solution or any other that you have. After that, give epidural anesthesia. In between the sacral and first coccygeal vertebrae, almost inject 5 to 10 milliliters. Apply local anesthetic lignocaine, gel and antibiotics cream on the prolapsed part and gently lift the uterine part and put it back into the pelvic cavity. Give isotoic fluid and calcium therapy, antibiotics and anti-inflammatory. After all, apply vulvar rope truss to prevent prolapse. Thanks for watching and subscribe our channel.